Hello, I am Dr. ABOUTH. I am a board-certified plastic surgeon based in Istanbul. Today, I want to talk about breast augmentation using silicone implants. If you want to grow your cup size, if you want to add volume to your breast, implants are going to be your main operation to choose. Other options include fat grafting or combination of fat grafting with implants. But fat grafting has its limitations, and so let's first start with implants. So if you want to grow your breast in volume, like I told you, the implants are going to be your main decision. The operation takes about 1 hour. Could be a little less or more depending on you. We make a little cut, a little incision under your breast, your inframammary fold, which is, as the name states, the fold, the crease, the line under your breast. We hide the scar in that line so that when looked from the front, the scar is invisible to the eye. Also, the scar will be hidden within the bikini or a bra, and the only way to see the scar would be lying naked on a bed or lifting your breast in order to see it. So the scar is going to be very well hidden. Other options for your scar would be around your nipple or under your armpit axilla. But these incisions have some downsides. The most important one is capsular contracture. So inframammary fold incision has the lowest rate of capsular contracture, and we will talk what that is in the upcoming minutes. So we make a little incision under your breast. We enter from that cut, and then we open a pocket, a place for the implant to sit in. This pocket could be under your chest muscle, your pectoralis major muscle, or above it. And when we say above the muscle, this could be above the muscle, under the gland, or above the muscle but under your muscles fascia plus gland. So using under the muscle means sacrificing the muscle and cutting it. But unless you're a professional athlete, this would not create any problems for you. Of course, both options have some downsides and some upsides. And the last option there would be to combine the two and do a dual plate, which means the implant is sitting partially under the muscle and partially under the breast tissue, which has benefits of both planes and less of the downsides of both. In order to understand the main differences between these two, let's first talk about the side effects, the risks, and the long-term and short-term complications of the operation. After that, we can understand what our options give us. So, like every operation, a implant operation is also going to have some risks. The first risk will be, say, general anesthesia operation, which means you will be down under the anesthesia for about an hour. Anesthesia might even have fatal complications, but depending on your age, whether you have extra diseases or if you're using any medications, you will have a ASA score, which indicates your risk for the operation under the general anesthesia. And if you are ASA 1 or 2, which means very little or little risk, then you would be very safe to operate on. So, unless you have some extra diseases or if you're over 70 years old, which is an unlikely age for you to have this operation, you're going to be safe with this one. Operation risks include, like every operation, bleeding, infection, and wound healing problems. Now, bleeding risk is about 2% on general operations. So 98% you would be fine. But there's a 2% risk that you would have a bleeding problem, which would create a hematoma, blood gathering inside your operation field, which means we're going to have to reoperate in an emergency or a semi-emergency setting to evacuate the blood and stop the bleeding. The bleeding usually stops by itself due to the pressure gathered inside your operation field, but you can't leave it like that. You have to stop the bleeding and evacuate the blood, because that could lead to potentially necrosis, infection, fever, wound healing problems, and if nothing happens, capsular contracture on the long run. What else? Infection risk with this operation is very low, but I prescribe protective, prophylactic antibiotics to my patients just in case. Your wound is going to be about 4 to 5.5 centimeters depending on the size of the implant that we pick, and that scar is going to heal very fast, usually within 2 to 3 weeks without any problems. One complication that you might have in first month, second, third, or fourth week would be seroma. Seroma is the gathering of fluid inside the operation area. This is not blood, this is serous fluid, which means clear colored, yellowish, orangish colored fluid. We take precautions against formation of seroma, but again, there's going to be a little bit of risk in regards to that. Not very common, but can happen. Now, let's talk about long-term complications. The long-term complications are going to include opposition of the implant, the capsular contracture that forms around the implant, and also sagging, ptosis of the breast. Sagging, ptosis of the breast is going to happen regardless of your having the operation. With time, as you age, your breast will lose the fight against gravity, no matter what. The bigger the breast, the faster your breast is going to sag. Now, if you have a very low volume on your breast, your sagging might be minimal as you age. But if you're over a B cup, C, or a D cup, you're going to have sagging, ptosis of the breast as you age, as you hit the 30, 35, or 40-year-old benchmarks. Pregnancy, childbirth, breastfeeding, gaining or losing weight, and gaining or losing weight multiple times in your lifetime. These are going to increase the sagging, the ptosis rate of your breast. Well, the implant is going to increase the total weight of the breast, which is going to add extra weight and pressure on your skin, and which is going to add to that sagging situation over the years. But if you're gonna pick a implant between 3 to 350s, you will not have a big addition to your pressure. If you are picking something above 400, 450, 500, then yes, we might see sagging a bit faster compared to lower numbers. But if that's what you want, you can still pick that. The other thing that we should talk about is the malposition of the implant. The implant might migrate over time. A migration, the malposition movement of the implant in a couple of months with a large gap is unlikely, but most commonly what we see is the implants move laterally outside with gravity over the years. And if this happens, well, the only way to correct this would be a reoperation. Same with sagging. You'll have to get a breast lift to correct that. And with malposition, you might not need a lift, but if you're having a lift and if you're having the implant malpositioned in a different place, of course we correct the place of the pocket. The last thing you need to discuss here is implant pocket capsular contracture. A capsule is the layer that your body forms around any foreign object, whether it's an implant, if it's a splinter, or whatever you have. So this is a natural reaction of the body forming a layer to a foreign object which it cannot destroy to encapsulate and have control over it. Now, this is not a problem, but up to 10 to 20% of the women will have a capsular contracture, which means the thickening, the hardening of the capsule. So your capsule would be much more thick and hard compared to what it normally should be. And as the capsule thickens, the first thing that's going to happen is you are going to be able to feel the capsule around your implant when you touch your breast, which would feel like a hard shell under your breast tissue. You can imagine this like an orange or a watermelon. The inside is soft, but the outer shell is hard. And the harder it gets, the more trouble it's going to cause you. As the capsule hardens more in grade 3 and grade 4, you will see the capsule hardening and contracting so much that will create the implant to change shape, which will change the shape of the breast as well. This could be in a manner that the breast implant's shape changes from a round object to different shapes, which we will be seeing this from the breast, or the contraction could pull or push the implants to different directions. This could create asymmetries between the breasts. Even if it's symmetric, this is going to be a unseemly appearance. So, in the further grades, you could feel pain due to this contraction. If you are having these later stages, then the only way to correct it would be to a removal of the implant and the capsule with surgery, and then putting in new implants. So, as we have talked about these, now let's talk about the differences between the plain pockets and the different implants. So, the first thing you should be looking at is whether you have enough breast tissue. Approximately, if you have over 2 centimeters of tissue on your breast, you have enough tissue to cover your implant. So you can pick whichever pocket that you want. If your breast tissue is so small that you would have a very thin covering of the implant, then we would recommend a under the muscle pocket. Otherwise, your implant would be very noticeable from your tissues. So, if you have enough tissue, then we can pick between the two. Over the muscle would be less painful after the operation. Under the muscle is going to obviously have more pain due to us cutting the muscle, plus putting an implant to a non-anatomical pocket, causing pressure on the muscle, so the muscle will be stretched. But this is just going to be about a couple of days to a couple of weeks, and this is going to be over. So this should not be a big problem for you, since the longer outcomes is more important. Over the muscle, under the muscle comparison, capsule contracture. Capsule contracture is seen less with under the muscle, so it has that advantage. But with very thin patients and athletic women, under the muscle can cause a thing called animation deformity, which means when you contract your pectoralis muscles, with the muscles movement pushing on the implant will cause the implant and also the breast to move, which could be a bother to some women. So you have that downside with that. Apart from that, both pockets are same in regards to breastfeeding, which does not affect the breastfeeding. So with implants, we're not touching the breast tissue at all in any pocket, so you're going to be fine with that. Dual plane is going to have advantages of both. So it's going to have less capsule contracture compared to over the muscle. But it's going to have less animation deformity compared to under the muscle. If you have a capsule contracture in the future, and if you're subglandular, when you change the pocket, it's a good idea to go under the submuscular plane. The advantage of dual plane is if you are having a minor ptosis of your breast, a pseudoptosis, which is the sagging of the breast tissue but not the nipple, or if you are having a grade 1 ptosis, we could use dual plane without a breast lift to achieve a good result. We just decide upon the separation limit between the muscle and the gland to lift the nipple a bit while putting the implant. But of course, this is going to be very patient dependent, and your surgeon should decide upon what to do. The last thing we're going to choose is your implant shape and implant type. So we have round or anatomical implants. Anatomical implants are also called teardrop shaped implants, which have more volume in the lower pole and less volume in the upper pole, mimicking a natural looking breast. So basically, a natural looking breast is not going to have a round half sphere shape. A natural breast is going to have a teardrop shape. So a teardrop implant is going to mimic that if you want to have a more natural shape. But a round implant is going to give you a more defined upper and medial. Another thing that is going to define whether you have a natural looking result or not would be your breast tissue. If you have more breast tissue before the operation, you're going to have a much natural result after that. So if you have enough breast tissue before the operation, you will still achieve a natural look with a round implant too. But if your main goal is to have that upper cleavage without having to wear a push-up bra, then round implants would be the way to go. For your reference, we use, in my practice, 95% round implants. What else? We have two different options on the surface of your implants: smooth surface or textured surface. This will not change in any way what you feel when you touch your breast. The textured or smoothness is on the micro level, so you will not feel any difference between those two. But the main difference between these two types is going to be the ratios of malposition and the capsule contracture. So textured implants have a much less capsule contracture rate and much less malposition rate compared to smooth implants. Of course, the ratios could differentiate between what the companies tell us and also what the research tells us, but as a rule of thumb, textured implants are going to be safer in that regards. So if you pick a textured implant, you're going to come back for a revision much later and much less. So the smooth implant operated people are going to be coming back sooner and in a much more ratio compared to textured implants. On average, there is no time limit on which you should change your implant, but when I look at revision surgeries from different surgeons, what I see is most commonly we operate on 8 to 10-year-old implants, but I have changed 3-year-old to 20-year-old implants. So you might live up to 25, 30 years with your implant, but this all depends on what you have, what you're going to live through, and what your thresholds for revision is going to be. And remember, most of these revisions are going to be for aesthetic purposes. Now, one downside with smooth implants is going to be the more risk of reoperation. And the one downside of textured implants is going to be a thing called BIA-ALCL, which is called breast implant associated anaplastic large cell lymphoma. So this is a fairly new discovered disease. It's a type of lymphoma that happens around the implant, inside the pocket, in the serous fluid collected there. And we believe that it is associated with textured implants. Now, the numbers on this can be different in different studies, but between 30,000 to 100,000 in one is the number that you're going to come up with when you look at the risk of ALCL. In comparison, breast implant risk is 12.5% in women on general on a lifetime. So, of course, breast implants do not cause breast cancer, but still, with the textured implants, you have this risk. So a very low risk, although you still have it. And if that happens, you're going to have to be operated on, and that is no joke. That is a cancer. So most surgeons are moving towards smooth implants nowadays. But this is an option that you should have a say in. So as a patient, you should have the decision to what to pick on. Of course, these numbers can change over the years. Basically, these are the main things that you should know about breast implant surgery. If you have any other questions, please write on comments, and I will make more videos on those questions. Thank you for watching. I am Dr. Buğra İpek, a plastic surgeon based in Istanbul. I'm a board-certified plastic surgeon, and please follow for everything plastic surgery and aesthetic surgery related. Thank you.